Final question. Who's supposed to do all this? Like I said, it gets harder as you go along. Well, the answer is we all have to do something. Government is really important. We will not be able to do everything we need to do to fight climate change, for example, and avoid a calamitous consequence either in your lifetime or your children's lifetime unless we have much more aggressive government policies, particularly at the national level. We do need an emissions trading system. We need a much more aggressive effort to accelerate the maximum use of solar and wind and other clean energy and stop using oil for transportation as quick as possible, completely. Because if it, let's assume oil was going to run out in 35 years. Let's assume the pessimists are right. We import 60% of our oil and use 70% on transportation. But we don't need oil to get around. We just use oil to get around. However, we do need oil for a lot of things. We don't know how to get around how to make plastics and some chemicals and a lot of other products without some sort of oil involvement. But if we stopped using oil to get around, if we could do it tomorrow, then that 35 years would immediately become 100 years. I don't know any expert who believes we can move civilization off an oil platform in 35 years, but most think we could in 100 years. So that would both help climate change and avert economic calamity. So there are lots of things that the national government should do. But the point I want to make to you is that if there ever comes a time when everyone you vote for wins and they do exactly what you think they should do, there will still be gaps between what is and what ought to be. And citizens have to step into those gaps. One of the reasons I'm glad that University of Miami has a really strong tradition of community service among its students is that we all need to get in the habit of doing that. Everybody can be a servant, everybody can give, no matter how much money you have or haven't, no matter how much time you have or haven't. We should embed in our minds the idea that a part of the price of living in this country is some sort of service in pursuit of the objectives that I just outlined. And this is I've been working on a book about this for about a year now to try to persuade people that they should think about this without regard to their income levels or their time availability, that everybody's got something they can do if they think about it in the right way. But the reason I say that is I've had a very unique perspective on this for 30 years now, 35 years. And my wife and I have changed, it was like we've changed roles on the dance floor. You know, from 1971, when we started going together, and we married in 75, I know it's the dark ages and it's terrible, until 2000, when I was leaving the White House and she was getting elected to the Senate, I was primarily a politician and she was primarily a citizen servant. And I always marveled at how much she got done. She started clinics to provide legal services to poor people. She worked for the Children's Defense Fund and advocated for the interest of young children. She helped grow our children's hospital in Arkansas to the 7th largest in the country. She started a statewide advocacy program for children and families that was nationally recognized. She brought in a preschool program for kids where parents teach their kids as their first teacher from Israel. It's now in 26 states, and the biggest one is still the one she started over 20 years ago, and never was elected anything. She headed up a committee to improve rural health care and to raise the education standards of our state. And when I ran for president, I got all the benefit of it. They said our state in South Carolina had shown the biggest improvement in education in the 1980s of any states in the country. All as a private citizen. I was watching this while I was slogging away, you know, in government, and I would get big things done that would affect huge numbers of people, and also spend a lot of time pushing rocks uphill that fell right back down, because that's the way politics is. So then she goes to the Senate, and I get to leave. And all of a sudden, I become part of the NGO movement, the non-governmental organization movement. And she's in politics. So I watched her try to help New York after 9/11 and come up with policies for climate change, health care, and economic revitalization. And all of a sudden, I just got to get up and decide what I wanted to do and how to do it. And I realized there were things that I could do as a citizen that I couldn't do when I was president. For example, when I started working with countries, beginning in the Caribbean, who had HIV/AIDS problems, I realized that the markets for the medicine were totally disorganized and dysfunctional. So the first country I went to work in, the Bahamas, we were, to give you a little, we pay $10,000 a year for AIDS drugs made by the big pharmaceutical companies. Same drugs the Europeans and the Canadians and the Japanese pay $3,500 for, exact same drugs, which is why they don't want us to re-import, and they tell you if we re-import from Canada something they made in America, you'll immediately drop dead. Because you'll be healthier if you pay 10 grand for it than if you pay 3,500. But anyway, the generic price of the AIDS drugs, that is the drugs made in India and South Africa primarily, was $500 a person a year, right? That's what it was at the time. So I thought, well, I'm going to go organize and raise money and get people to go give care to people with AIDS, and I'm going to buy this $500 medicine. So I go to work in the Bahamas, which is the wealthiest country in the Caribbean, and they are buying the generic medicine for $3,500. Same stuff you buy in India for $500. Because the market was so disorganized, they didn't know. And they ran it through 2 agents who bumped the price up that much. So the first 4 days I was in business, we negotiated the price back down to $500, and all of a sudden the Bahamas could treat 7 times as many people as they were treating before for exactly the same amount of money. So then we thought, well, maybe we could do more of this, because if we agreed to buy these drugs in big volumes and have certain payments, maybe we could cut it again. So then we cut the price to $140, and today that price is about $100. And for children's medicine, it was $600 because the volumes were so low, so we cut it to $190, and now we have a program that we're doing with a group called UNITAID, spearheaded by the French government and others, that they put a small tax on airline traffic to pay for massive health care advances, and they ask us to buy the drugs. We can now get these kids drugs for $60, and they were $600. Now, the point is, if you're in the non-governmental world, and I have time to worry about that. If I were president, I couldn't think about how I was going to negotiate the deals for Indian and South African pharmaceutical companies when my own companies didn't want us to spend money on anything like that. See? So it's a different deal. When I agreed to try to work on childhood obesity, we made agreements with the snack food industry and the soft drink industry to try to cut the caloric intake of snacks and soft drinks available to kids in the schools, even as we tried to get the exercise and physical education programs back up, both in the schools and the communities, and have more wellness efforts. Because if we don't do something about this, the kids now in public schools may be the first generation of Americans to live shorter lives than their parents. We're already spending 20%, as Secretary Shalala can tell you in her previous role, 20% of the Medicaid budget, health care for poor people, on paying for the consequences of diabetes. Not just diabetic care, but blindness, heart attacks, strokes, amputations of young people. We have, for the first time in history, statistically significant numbers of young people with what we used to call adult onset diabetes.